所以我们严重的脱失了，非常抱歉。这个张主任有请。
好，谢谢管生教授。
Thank you, Professor Guan Sheng. My topic is about Web China. This topic is based on a multi-center research and the evaluation on clinical trial. Web has been used widely in Europe, and Europe has accumulated experience. I would like to share with you some cases about the web to be used clinically. Well, we know web is used for the bifurcation, wide neck aneurysms. Of course, we have to use the adjuminate stent and a coiling, and also we have to use the stent. But of course, it will bring some problems like thrombosis and a lot of mental devices to be put into the vessels, and also the problems about the satisfactory rate of the patients, unpredictable risks. That is why engineers are studying web. Web is a new concept to be placed in bifurcation aneurysms. As you can see, this is a ball-shaped or pillar-shaped device. FD is like a diverter, but here this is the devices to stop the flow or to prevent the high jet flow to be ejected on wall of the flow of the blood. Well, web started in 2010. Web used to be very hard and very big. It used to be very hard woven, but now web is small, flexible, soft. By using microcaster, we can push web. Well, it is applicable for 2 to 10 millimeter aneurysms. SLS type is applicable to 3 to 10 millimeters aneurysms. Different type for different aneurysms. Well, for the pillar shape and ball shape, maybe the malposition will be induced. Well, the tiny web is 17 microcaster. A microcaster can be reached to all vessels in the brain, but in China, we have larger caster, around 33. Advantage of web. App will stop the flow, or app will disturb the flow, and also it has a good positioning result. The biggest advantage is it will avoid a double antiplatelet drug post the surgery, and it is applicable for the patients who will have a high rate of rupture aneurysms. Well, as you can see, this is a very, it's just like a scaffolding, so that a lot of it will easy for the skin to grow in the upper part. Well, as you can see, it has a high density mesh. Well, as you can see, the shape is inward instead of outward. After the clinical trial, most of the clinical trials of web were done in Europe, and one was done in the US, and China is a little bit later than the US. We also had a clinical trial on web. There are 6 trials, and we achieved a good result. The application are used for the aneurysms in stomach. Some experts are using web for treating ruptured aneurysms and achieved a good result. We're discussing the application of web on large ruptured malformed aneurysms. We inject Coca-Cola into the web, In this case, you can see the liquid was very well sealed. Web has little impact on flow. App can achieve the same result as FD. Several hospitals worked together to complete Web. Last August, we had 60 cases. We have completed 6 months to 1 year follow-up on cases. This is a clinical trial before the market, before we getting the result. It is very hard for us to analyze the result of the Web. That is why I cannot report you clinical test result. I would like to share with you some cases which have a very specific features. The first case, a ruptured aneurysm. All cases here are stomach aneurysms. As you can see, a lot of vessels. As you can see, the operation of Web on stomach aneurysms. Microcaster is placed, and it is very close to the choroid aneurysm, carotid artery. Well, as you can see, the shortening of the Web. It seems like it's very close to the wall of the aneurysms. Web is very soft. Once Web is expanded, the distal area will be shortened. In the 6 months follow-up, as we can see, wide neck aneurysms were fully recovered. This is also unruptured ACOM aneurysms. If the catheter is hard, well, as you can see, it will reach the wall of the vessel. When the Web to be put, the Web is expanded, then Web is shrinked. So we can put Web well. And this is the angiogram. As you can see, the flow won't inject to the wall. After 6 months follow-up, we can see the occlusion rate is good. Well, I think this is good for the Web, for the wide neck occurrence indication. As we can see the sacs is dangerous even though it has not been ruptured. We can see the sacs and we can see where the sacs are. And we want to cover the neck of the aneurysms by using Web. This is how we push and release Web. And also, after the releasing, we do the angiogram. Well, as you can see, it stops the angle of P1. And with this kind of hindering, we will put the wire through and we will use the ball to protect the carotid, the carotid. And it's very hard for us to turn the angle. This is the post-procedure result. Well, as you can see, some gap. And this is the result after the releasing. And this is the angiogram after the procedure. Six months follow-up. Web covered the neck of the aneurysms well. Well, in the long-term follow-up, there is no recurrent rate. Because, like I said, the material is very flexible. Well, as we can see, it looks like the neck of the aneurysms Actually, this is the remodeling of the wall of the aneurysms. This is the wide neck aneurysms in the stomach. This is a three-dimensional angiogram. Well, if you look at the embolisms, of course, we can use ball, we can use stenting technologies, but now we use the stamp to do the embolism. Well, as you can see, the diameter is 33 millimeter. And the position is higher. The passage is very smooth. And we push it into the aneurysms. Before expansion of the web is hard in the catheter, and this is how we push the web into the aneurysms. Avoid touching the wall of the aneurysms. When the web is expanded, the material is very soft. Normally, it won't damage the aneurysms. This is how we push forward the web into the aneurysm, into the catheter. In order to achieve a good expansion and a coverage result, we do some slightly adjustment. This is how we release web. And we push all the web out. Well, if you look at big catheter, when a catheter to be pushed into the vessel, the form has been changed. So we have to see the result of the carotid artery, and we achieved a good result. Well, as you can see, the artery is quite smooth, and we achieved a good coverage result. Then we have to push and pull to see whether web is stable. After the expansion of the web, we worry it will block the artery. This is the release. As you can see, some wires. The wires are in the artery. It won't impact the blood flow. As you can see, when we retreat all those catheters, you can see the change of the blood flow. However, web is very stable at this moment. Now, through the angiogram, we can see it has a good coverage on the neck of the aneurysms. As you can see, all the arteries are very smooth, and we have a very canalization result. After 1 year follow-up, we detected some problems. This is a wide neck aneurysms. If we use coiling with assisted stent, we can achieve a very immediate result. In a 6-month follow-up, we can see some flow in the surrounding area. This is the 1 year follow-up. Even though there is unruptured aneurysms and aneurysms does not grow, but still we can see some blood to be into the aneurysms. This is the anterior aneurysms. We place web into the anterior aneurysm. The procedure is quite smooth and successful. After 6 months follow-up, well, still we can see the expansion in the neck of the aneurysms. When we use SL-type web, the web will be shrinked. So we can see some neck of the aneurysms to be exposed. But whether in the future, whether the aneurysms will be stable or will the aneurysm grow? Well, if we read overseas report, we can see this kind of aneurysms, the neck of aneurysms are very stable. This is the report of our follow-up. This is another aneurysms. Well, as you can see, this is the image of the embolization. For different types of aneurysms. Well, as you can see, there are a kind of a top point. And for this kind of patients, we're doing the follow-up. And we are trying to see whether there will be the recurrent rate, whether the patient condition is stable or unstable. We have found WEB is convenient to operate. WEB is achieved a good result. Based on our experience and the data, like I said, we had 60 cases. WEB is very good in using the bifurcation aneurysms, and it's very easy to operate. It achieves an immediate result, and for patients, they don't need to take long-term antiplatelet drugs. It has a good position. As long as the position is good, the recurrent rate is lower. And also you can see the neck of aneurysms has a long-term stable condition. For the stent and for the bore-assisted technology will help the WEB to be well applied in